One of the most perplexing things that we as dentists see that is of great concern to the patient is temporomandibular pain disorder, or TMD. Often patients feel they have a brain tumor, and this creates anxiety. But what we do know is this basically is muscle spasm, which is caused by clenching the teeth and causing muscle pain that is reflected in front of the ear. And as I said earlier, patients think that they have a brain tumor, and what does this do to the anxiety? It increases that very much. I found in my practice, and most dentists find the same thing, that the vast majority of this is found in females when compared to males. So anyway, treatment options can range from simple to radical, and we want to talk about the simplest basic technique, which can be done by any dentist, does not require a specialist, can be done by any restorative dentist if they thoroughly understand the problems. And I'd like to thank Dr. Jeff Fields and Bill Ursulis from Venice, Florida, for supplying me with some of the data that is included in this tape. Now let's go to the tape and let's talk about what you as a restorative dentist can do to not only treat but reassure patients with TMD or temporomandibular joint pain. Let's talk about the simple things that we can do to treat this problem. So when we think of temporomandibular problems, what we're thinking about? We're talking about bruxing, we're talking about clenching the teeth or grinding, and we're talking about joint pain that centers itself in front of the ear and may appear as an earache, as well as pain in the muscles surrounding that area. Here's some facts that I think we need to keep in mind. First of all, you should realize that your teeth should touch only lightly when you're chewing or swallowing, at no other time. And when your jaw is at rest, the lips should be together, but there should be some slight space between the teeth. Emotional stress is always the trigger factor in this. And sleeping position is important, because sleeping on your stomach and supporting your jaw with your hands can force the jaw out of position and make that hurt. So you should either sleep on your side or on your back. And clenching and grinding may make teeth sensitive to heat and cold, because this traumatizes the nerve within the tooth. The guidelines for selective patient management. First of all, you need to encourage the patient to sleep on their back or their side. May be easier to sleep on their side, but ideally we'd like to see them sleep on their back. Apply moist heat to the temporal area, especially before going to bed at night. Perhaps taking a hot shower and letting the shower just beat down on the jaw area may be adequate. Generally eat softer foods. That does not mean you have to get on a soft diet of just scrambled eggs and mashed potatoes, but you want to avoid limit your jaw movement. So we need to discourage the patient from biting on objects such as pens or pencils, and biting on, say, a carrot or an apple with the front teeth can cause the problem. And eat foods that are not as chewy as necessary, and certainly you don't want to chew gum. And resting the chin on your hand can put pressure on the jaw. And it's not so much a problem now with cell phones, but cradling an ordinary phone between the ear and the shoulder is a habit that you need to get rid of. Treatment. First of all, always reassure the patient that this is a muscle spasm problem and is not caused by a brain tumor. They're already stressed because they have the problem, and if you add in they think a brain tumor, what does this do? It increases the stress even more. There are many devices out there to prevent the teeth from contacting, and these include occlusal guards, night guards, deprogrammers, and so forth. And occlusal therapy by selective grinding and reshaping the teeth generally goes along after you begin to get some relief. Over-the-counter medications can help, especially for inflammation. These can be the non-steroidal anti-inflammatories. We're talking about aspirin, we're talking about Tylenol, we're talking about Aleve, we're talking about medications like that. They often appear to be somewhat helpful. You can also use medications which are designed to reduce anxiety, and if there's some depression involved with this, perhaps those would be recommended. And also recommendation of medications to enhance sleeping. Now, dental procedures that may be considered, especially after you've gotten rid of some of the acute symptoms, would be to do some more selective grinding to reshape the teeth so that you get a more ideal occlusion. Certainly you want to replace missing teeth, and ultimately you may need to have some orthodontics done to get the occlusion corrected to the level that you want. Now, as an addendum on this, advise the patient that during stressful times the symptoms may reoccur and they just need to repeat the things that we've already discussed. We must also realize that patients with mental illness may not be able to follow this treatment protocol. And again, I'd like to thank my two colleagues in Venice, Florida, Jeff Fields on the left and Bill Urslis on the right, for the forms that they contributed and the ideas that made this video possible.